I think people think if you have OCD, you're this type of person to go around spotlessly cleaning your house from morning till evening, making sure all your pens and your desk stuff is in the same order. And when you get to the office, you unpack a bag in a particular routine. What I described earlier was probably obsessional traits. OCD is a specific clinical disorder, and by that I mean these are symptoms that cluster into different areas of obsessionality, it's like what the word means, and compulsive behavior. So we have a lot of thoughts that people will have about particular things that make them feel uncomfortable, and then they have to do certain things to try and manage that discomfort for themselves. And that would mean repetitively doing things. So one of the things would be like, for example, I feel dirty or I feel unclean, and that would be the thought that comes into the head. They have to keep washing their hands, and then as they wash their hands the first time, they realize, oh my gosh, I might have touched something, I'm still dirty, I need to wash my hands again. And that carries on, and they can't stop themselves, and eventually they find they're spending about an hour to 2 hours washing their hands. And that's the point behind OCD, is that it's quite distressing for the patient and distressing for people around them who love them to see them suffer in this way. And often it frustrates people because they don't understand how they can't stop themselves from doing these things. But it's difficult, and that's the point that makes it a disorder. So at TalkMind, we often see patients with OCD, and the first point of call might be myself, or you might see a psychiatrist who would then do the assessment and come up with the diagnosis for OCD. And so we would look at the different areas of treatment that the patient would need, and so therefore we'd use medication. But that's not the only way we treat OCD, and often, for example, there might be psychological interventions, different mechanisms that a psychologist here at TalkMind can help you with in terms of helping and making sure you try to manage that anxiety, reduce some of those behaviors, change some of those patterns of thinking, and help you lead a better quality of life.